Okay, this is probably the most asked question that patients that are coming into us or are deciding whether they want to come into us and get something checked out with their foot or their ankle is, when do I seek medical treatment for this? So when does this become a problem that if I ignore it, maybe it'll go away on its own. If you guys have heard me talk before, you know that doesn't really happen, but can occasionally. But when do I consider this like an injury or like a serious problem? So the general guidelines for that are for almost any problem. If the pain is not getting better over a 7-day period, or if it's getting worse, it's a pretty good indication that something's going on there, that you have what most people would consider like a true injury, where there's something significantly wrong with soft tissue that might be causing pain with activity that you do. So if that's happening, then you need to get in and see somebody. And then now you've kind of decided, okay, this isn't going away, it's actually getting a little bit worse. What do I do? Like, where do I go? Most people will go to their general practitioner. That's kind of how we've been conditioned to do things in Western medicine. In terms of what would happen treatment-wise, there is your general practitioner. You've heard me say this a million times. General practitioners are amazing. I don't know how they do that job. They have so many things they have to know. In their waiting room is someone with the flu, someone with a swollen ankle, and someone with some kind of weird skin irritation. I don't know how you treat all that stuff, but basically, they're not orthopedic specialists. So what you want to try to do, if you can walk around, there's nothing significantly wrong, you haven't had severe pain for long periods of time, then typically your best course of action is to come in and see a physical therapist. Because a physical therapist, as soon as you come in, we start working on the problem that day. So we have direct access in Pennsylvania, so you don't need a prescription from your doctor. We still communicate with your doctor. We want them to know everything that's going on, but you don't need to go through that process. And unfortunately, what we see is when you go into the system that way, you can get unnecessary medications and diagnostic testing. So this stuff is getting expensive, so we're trying to solve this in the cheapest way possible. And a lot of times that is going right to your physical therapist, which is kind of where sometimes you end up anyway. So just coming in to get, and what we offer is a free screen. So anybody that is having questions, specifically this month we're talking about foot and ankle pain. If you're having questions about that, the easiest thing to do is just come in for a free screen. It's a 30-minute appointment with a physical therapist. Costs you absolutely nothing, and you get a diagnosis. We tell you what's going on. So I've been kind of educating you about plantar fasciitis, heel pain, some Achilles tendinopathy, tarsal tunnel. You got to find out what the cause is first. So once we find that out, then we let you know what that is. We give you a prognosis, like, okay, how long is this going to take to fix? If we see something that is out of our scope of practice, like, yeah, we need some diagnostic testing on this, then obviously we'll send you for that. But for the most part, 99% of the people that come in for a free screen are usually helped just with regular old conservative physical therapy. And then we give you a plan. We tell you what we would do, to get rid of your heel pain. So we have an opportunity to do that this month. You'll get some more information about that. If you have any questions about, hey, I just don't know if this is going to go in its own. If I try some of the stuff you showed me in these other videos in terms of ice and behavior modification and some stretching, we showed you the number one exercise you can do to get rid of heel pain. If you've done that stuff and it doesn't work, then you're better off just coming in and get a free screen, get your questions answered, and we can help you from that standpoint. So if you have any questions about that, then just reply to this email, or you can comment in the Facebook post, and I'll talk to you soon.